everyone's waiting for just the severe chest pain or tightness, you know, with that radiates to their jaw, and they get all sweaty and they just feel terrible. Yeah, so that does happen, but for the vast majority of people, the symptoms are much more subtle than that. And the best message that we could give the community is that when you develop any symptoms that could be the heart, and they can be subtle, in particular women, diabetics, older people can have very subtle, or we call them atypical symptoms, nauseous, just feeling unwell, that really the first point of call for any urgent heart symptoms should be by dialing 000, because we know absolutely that if you diagnose a heart attack in the ambulance with a ECG, so you do a heart rhythm strip, that you set up the whole pathway for urgent treatment to open the artery, protect the heart, and the chances of you know, instant and ongoing recovery where you can be home from hospital after 2 days is much, much better than the alternative, which is waiting, you know, hours, going to see the GP, getting a blood test, or even doing nothing and seeking help a few days later, where we know you can have dire consequences of that, which is cardiac arrest, or even you can just have your full completed heart attack where the therapies just won't nearly be as good. So one message that we know has not really reached the community is that when we track the time that people take to call 000 or to seek medical attention, in the last 10 years hasn't really changed. And so if we could do one thing, it would be to get people to call 000, engage an ambulance sooner when they suspect that their heart may be at play. The best thing would be, you ring 000, they bring you to hospital, and your heart turns out to be healthy. Everyone thinks they've wasted our time, but that's a fantastic option. When we look back at survivors of sudden cardiac arrest, you know, 50 to 75% of them have warnings in the weeks before. It's like the body is trying to give you a message that something's not right, and so what we want people to do is listen to their body, listen to those warning signs.
What sort of warning signs?
Well, it may be that you're just getting a bit more fatigued when you're going for your walk. It might be subtle chest pains when when you're walking up that hill or the flight of stairs that you could usually do. It's the body trying to tell you that the heart's not right, there's a threatening issue, and it's like 100% better to pick it up then than to wait for the heart to have a full-blown heart attack, or worst case scenario is to develop cardiac arrest where we're really behind the 8 ball at that stage.